Thank you, everybody. I'm delighted to be here. I'm Gemma Cox, Evaluation Manager in the HSE National Office for Suicide Prevention. And when I was invited to undertake this, at this time we're in the middle of an evaluation of the strategy. So I suppose we've been sort of reflecting back, thinking about the work that we've been doing, and also looking forward what needs to be done. So I think within this kind of reflective space, I thought what I would focus on was looking at how, under the Connecting for Life strategy, we've been using data and evidence to drive our work. So that's going to be the focus of my presentation. Sorry, I actually think I need my glasses. I'm that age now where I think varifocals are what I need. Thank you, because that's actually so big up there. Lovely, thanks so much. So just to follow on from Ray's note, this comes with a little health warning. So the information included here places emphasis on data, and as such can appear to depersonalise the pain and loss behind the statistics. So the HSE NOSP acknowledges individuals, families and communities affected by suicide each year in Ireland. So turning to what we're going to look at. So I suppose I'm at risk of stating the obvious here, but I thought what I might start with is looking at why data is important to suicide prevention, and then who that data is important for. And then I'm going to shift and look at the strategic approach to data that's embedded in our national strategy, Connecting for Life. And then we're going to shift focus again. And what I'm going to do is I'm going to look at a couple of examples of work that's happened under the strategy, where this work has taken data and evidence and is guiding a whole extensive program of work. And we're going to look at that under 4 different domains. And just really to highlight, this is going to be quite light touch. I'm not directly involved in most of this research, so it's not really, I don't think, my position to speak about this, but I'm hopeful that it'll spark your interest and that you may go and look a little bit further. So firstly, why is data important to suicide prevention? Well, I think when you look at this, you can kind of break it down into 4 key areas. And firstly, we need data to prioritise population groups. So what we do know is that while suicide and self-harm can affect anybody, regardless of your age, your gender, your sexual orientation, where you live, at the same time, we know that certain people are at increased risk and certain population groups are overrepresented in mortality and morbidity data. So it's really important that we identify those groups, have a bit of an understanding of the scope and scale so we know exactly what we're dealing with, and also try and dig deep and get a bit of an understanding of the needs of these kind of people. So that then, thirdly, we need data then to determine risk and protective factors for suicide behaviour. And again, we know, primarily from the international literature, that there are many different types of risks that contribute to suicide and self-harm. But what we also know is that some risks are represented in a very small number of people and have a very significant effect on individuals. Other contributory factors are much more prevalent in the population and are not as significant. But suicide prevention measures really need to address all of these. And finally, and connected, I think, to our work at the minute, is we also need data to monitor progress and trends. So that is, progress in terms of implementation. And that is a key thing we're looking at the moment under the evaluation of Connecting for Life. But also we need data on trends, and that's trends in changing patterns in self-harm and suicide nationally and locally. So that's why we need data. Who's data important for? Well, again, we can break this down into a number of areas. Apologies, I can't read this. And I've looked at it under 4 key areas. First of all, government and policymakers need data. So they need data so that they can engage in evidence-informed decision-making, which is really, really important in the 21st century. It's no longer good enough to do something because it feels like it's a good thing to do. It has to be rooted in evidence. Secondly, they need data so that they can respond to any kind of emerging issues. And thirdly, they need data to demonstrate the effectiveness of their prevention efforts. And that's the situation, again, we're in at the minute. We need data so that we can show the effectiveness or not of Connecting for Life and the programmes of work contained therein. Also, obviously, service providers, be they the HSE or NGO partners or in the community sector, need data. So they need data in order to identify current trends and create targeted interventions for the at-risk or priority groups. Then they need data in order to demonstrate and or assess whether these interventions are effective. And really importantly, they need data to make midterm corrections in implementation of interventions. So once we have the data to show, okay, it works better for these people, interventions can be tweaked in a way that will make them much more effective. We also need data to promote and support evidence-informed policy reforms and to help ensure appropriate resources and support systems are put into place. And then thirdly, our media and comms colleagues who work in this kind of mental health space, they need data to create targeted public awareness campaigns that can cater to the needs of these specific priority groups. They need data to understand public perceptions of mental health and suicide and informing strategies to reduce stigma and misconception. And they need data to highlight the availability and effectiveness of support systems, encouraging individuals to seek help where needed. So, turning now to our National Suicide Prevention Strategy, as Goal 7. The aim of that goal basically is to ensure, is to ensure that we have better data and research. And more specifically, Goal 7 says it aims to improve surveillance, evaluation and high quality research related to suicidal behaviour in Ireland. And under that goal there are 9 actions, and they set out to address these 7 strategic objectives presented here. So as you can see under the strategy, and it's perhaps quite unusual for a national strategy like this, there is an enormous programme of work that is focused on data, research and evaluation. So we have strategic commitments. But I think what's also really important about Connecting for Life is that it also sort of embeds data, research and evidence into its work in a number of other ways. So the strategy explicitly recognises that responsive, cost-effective and efficient suicide prevention strategies are dependent on 4 types of data, and this is stated in the strategy. So firstly, it's data showing the effectiveness of services and interventions. That's absolutely essential. Then we need data on groups vulnerable to suicide. We need data on key risk and protective factors, and we need data on monitoring trends and progress. So the strategy also recognises the challenges in achieving this. So around the outside, this probably isn't very readable. They recognise that in order to achieve this, the 4 key things need to be done. We need effective monitoring and evaluation partnerships. The scope and scale of this work means we can't do this alone. So secondly, we need better integrated data surveillance systems. So we'll have an awful lot of discrete systems in Ireland that aren't connected and don't speak to each other. Thirdly, we need to improve the quality of the evidence base, and again, to help ensure that we're implementing evidence-based and or informed interventions. And really importantly, what Eve also referred to is this effective translation of research into practice. And that is particularly challenging. And it's making sure that we have data that we surface up the findings of research and into sort of usable and actionable information, and that we get that into the hands of the people who need it, be it policymakers or service providers. And that is quite a challenge for us. So I'm now going to, having seen why we need data, who needs the data, and how data is embedded into our National Suicide Prevention Strategy, I'd now like to just highlight some projects that have come to mind when I was thinking about this. And I suppose in a way it's kind of obvious when I was reflecting on the work over the last year, given we're in the middle of an evaluation and we're being interviewed ourselves, so it's that kind of reflective time. And on one hand, it's quite obvious, but sometimes it isn't. I think data can be a key driver of work. And that's kind of what I want to show you, because I think sometimes we may not necessarily be aware of that. And I'm going to look at those 4 themes that are highlighted under the strategy. So firstly, when it comes to service and intervention effectiveness, under Connecting for Life, we've commissioned an awful lot of evaluations since 2015. But this one sort of stuck out for me for two key reasons. Firstly, it is an evaluation of an intervention. Sorry, the evaluation has two components. It's an outcome evaluation and a scalability assessment. So it's the fact that it's an outcome evaluation is quite unique because it's very, very rare, as we may all know, to have outcome data for an intervention. It's just exceptionally challenging. And as part of this intervention, the collection of outcome data was embedded into the delivery of the intervention. So it allowed us to evidence outcomes at the individual, at the level of the service user. And the second part of this evaluation was the scalability assessment. And this is in line with best practice. So if we can evidence that an intervention works, best practice says that we need to assess for scalability. We need to start moving effective interventions out of a piloting stage, bring them up so that they can be implemented across the country and ensure that there is some equity in terms of service provision. So this particular evaluation, I'm not going to talk hugely about it, but the intervention was being delivered in the adult mental health services in North Dublin, and it's called the North Dublin Psychology, Suicide Assessment and Treatment Service. And at the heart of this intervention is CAMS, Collaborative Assessment and Management of Suicidality, which is an evidence-based American intervention that sort of provides a therapeutic framework that can be wrapped around any mental health intervention. And at the heart of CAMS, Collaborative Assessment and Management of Suicidality, is a form which is called the Suicide Status Form. And this form is used, it is multi-purpose, it's used as a screening tool, it's used as a therapeutic tool, and it's also used to track progress through the intervention and as an outcomes tool. And so that's where the outcomes data came from for this particular evaluation. And this graph here presents pre-post changes in individuals across the domains that are assessed using this particular form. So I'm not going to say much more about this, except as a result of this evaluation, I certainly became a champion for CAMS, as did many colleagues internally within the HSE, NOSP and externally. And we certainly did our best to look at and resource implementation of CAMS in other contexts in Ireland. How successful we are in that regard is deeply questionable. I think that's a presentation for a different conference, maybe a conference on the challenges of scaling up. So I won't say anything more about that, but I would recommend you get onto the HSE website. There's a really good report on this on the website. It's very detailed, and it goes through in a lot of detail the scalability assessment and presents a lot of the outcomes data. So the second project that's looking at services, effective services and interventions. This is somewhat different, and I realise that somebody is going to be presenting on an aspect of this study today, so hopefully I'm not going to say too much in relation to that. But this is again a project that was commissioned under our collaborative research grant scheme, and it was from UCD Psychology, Agriculture and Chagas. And this is just a great little project, I think, because it started out as they were seeking to develop a suicide prevention intervention for farmers in Ireland. So what they did was they were planning to undertake a survey examining the risk factors for suicide amongst farmers. So in line with best practice, this started with an interview, I think, of 10 farmers. They then moved on to 5 focus groups with farmers and a focus group with service providers, all of which led to inform the strategy, or sorry, the survey. And the survey contained a number of standardised instruments. So all of this was sort of carried out in line with best practice. So they launched the survey. It was a national survey, and it was completed by 256 farmers. And what they found was that more than 1 in 5 farmers who completed that survey were considered at risk of suicide. They also found that farmer stress was associated with higher suicidal ideation and higher distress. And they also looked at the top stressors for farmers. And I thought this was absolutely fascinating. The first stress, and perhaps quite obvious, the first stressor was government policy designed to reduce climate change, which I thought was extraordinary. It's not climate change, it's policy response to climate change. And then they also found that amongst farmers, psychological skills were associated with lesser suicidal ideation and lesser distress. And at the same time, our colleagues in UCD, which is Professor Louise McHugh and Professor Thomas Russell, have been working with myself and colleagues in NOSP analysing mortality data from a coroner's project. And we found that 8% of, we found that male farmers and agricultural workers accounted 8% of all probable suicides in Ireland over the 3-year period 2015 to 2018. So all of this work clearly shows that farmers are at risk. We know that. But what I love about this project is that it kind of grew legs. And so now, and they managed to get additional funding and resourcing. So now it's expanded into something which I think is absolutely amazing. So firstly, we have the Dying to Farm project, which is the follow-on from the survey there now, and they have now developed a therapeutic intervention for farmers who are in high stress or distress, and that is being piloted, and as they're piloting it, they are evaluating it. They've also got additional resources, and they have this Farming Minds project, which is to develop and implement evidence-based interventions to improve farmers' mental health throughout the country. And they have this So What project, which I think is great, and that is looking at sort of connecting farmers and policymakers in the climate change space. So I'd encourage you all to get on. I can't do justice to this work because it's just so vast. So I'd encourage you all to get on to the UCD website. They have an agri-mental health funded projects page, and you can find out a lot more about this work. So now I'd like to just turn and look a little bit on groups vulnerable to suicide. So you may recall when the strategy was written in 2015, there were quite a large number of groups that were identified as priority groups, which is brilliant, but there's an awful lot of them. And it's really interesting when you look at and read that document. There's no parameters around this. We've no understanding of, you know, the scope and scale of the issues within these priority groups. We're now in quite a different space, I think. And again, just following on from Eve's, one area I think a lot of progress has been made is in terms of those bereaved by suicide. So in the strategy in 2015, individuals bereaved by suicide were recognised as a priority group and a vulnerable group. But again, we didn't have parameters around that. So we've worked with the Department of Health, and we have managed over the years to get a module on suicide prevention included in the Healthy Ireland surveys. So you may be aware Healthy Ireland is a national household survey, and we've had module on suicide prevention included in 3 and perhaps 4 surveys. And what that shows is that 69% of the Irish population have known somebody who has died by suicide. And it also shows that 1 in 8 respondents reported that they knew someone who was close or very close to them who had died by suicide. So that gives us a sense at the population level on the scope and scale of this. And then, as Eve has referred to, the afterwards study done by herself and Fiona from HUG, which was a survey, this amazing, enormous survey of 2,413 people. And that survey found that 56% of those bereaved by suicide reported poor mental well-being symptoms of depression and anxiety. And interestingly, it also shows that these were twice as prevalent among those bereaved as among the general population. And it also showed that 1/3 of those bereaved did not access any supports following their loss. And this is only just touching on the enormous amount of information that's available in that survey, so do get onto the websites to check it out. But what's really important is all of the information of this is being used by HSE NOSP and our colleague Ollie Skean here, leading out on this huge programme of work around suicide bereavement and postvention. So the data is being used. 5 minutes. So sorry. Apologies, I'm terrible when I get a microphone in my hand. Just quickly, I'm going to look at this is data we have on those second group, which is an LGBTI community. Again, when the strategy started, we had no data. So there has been 2 surveys. I'd encourage you to get on, look at these surveys. They're amazing. So, and unfortunately, what the data is showing is that between 2016 and 2024, there has been increases in suicidal ideation, suicidal thoughts among members of this community. There has also, unfortunately, been an increase in suicide attempt. So we hope to do a lot more work with our colleagues in relation to this to find out, to dig a little deeper and find out a little bit more about this. Apologies, I'm going to have to move on. So in terms of risk and protective factors, there's one study I'd like to draw your attention to. It's called Planet Youth. And it's a secondary analysis of data, and there's data on over 5,000 young people over in the west of Ireland. And this has really in-depth information on risk factors for young people. And they used a particular scale, and all the risks are presented here. And the risks sort of cover a number of domains. It's risks in the home, risks in the the home, school, and peer. And what they found really clearly is if the young person is experiencing adversity across these 3 domains, they are at greater risk and they need to be targeted. Worryingly, the survey also found that 1/3 of the students had reported self-harm and 8% had reported a suicide attempt. It also has really good data on protective factors, which is quite unusual, and we've listed that the protective factors are presented here. So sleep, school safety, parental support, physical activity and friend support. Importantly, these weren't protective factors for all. So again, if you get on to, it's the Child and Family Research Centre in UCD, so the UNESCO Child and Family Research Centre. You'll see a lot more about that. In terms of monitoring, a really good project that's in place has been led out by the Irish Prison Service, and they work with our colleagues in the NSRF, and it's monitoring the incidence of self-harm in prisons. And through this linkage with the NSRF, the data is analysed, it's published, which is fantastic. But what's most important is this data is presented every quarter to leadership and decision makers within the prison service, and it is informing prison policy, it's informing cell occupancy, etc. And that's what matters, is that data is used to drive work. So hopefully I've shown you how we've, under the strategy, there are a lot of projects that are ongoing that are using data, and we intend to do this for the next suicide prevention programme of work in the country. But we can't take this for granted. We're doing well at the minute. This doesn't mean that things will continue. So we recognise it's really important for us to nurture our existing relationships with our academic partners and our NGOs and build new ones. It's really important that we build the capacity of leadership to undertake the basis of data-driven decision making and to be open to shifting priorities based on the data findings. We also need to make sure that data is available at a local level, and that is something that is coming out, emerging findings, I guess, from our evaluation. So look, thank you all very much. Apologies for my timing on this, but I hope I've given you a sense of why data is really important, and we really need to make sure that it stays on the agenda. Thank you, everybody.